Okay, so hopefully you can all see this appropriately. As the exercise goes, we're trying to find ways to generate patient active approaches without contracting the area that we're working on. So the area that we're working on is the neck. In lateral, you run out of a lot of motion options because if you're going to lift the head, your hands are going to be in awkward positions. You're going to be doing all this. You're going to be in front of them, cradling them directly into your abdomen or your chest. It becomes a real problem. If you just sit at the top of the table, if you have any reason to be treating the neck in lateral, there's going to be a lot. There's not going to be a lot. There's going to be very few reasons why you're going to do this. They can't be in any other position, and you have to do it. Right? That's pretty much it. Like they're in a lot of pain. They need to be supported. Say their low back really hurts, but their neck is a problem. They can't lay in any other position than lateral. There you go. It's basically this would be your second last resort, and prone would be your absolute last resort for working on a neck. Seated and supine are better. But what this is going to do is give us the opportunity to show you a decent opportunity for control, show you how we have to consider what we're trying to keep still and what we're trying to move, and then also give me an opportunity to show you the difference in people. So we're looking at patient activating approaches or patient active approaches by not utilizing the neck itself. So the thing that I need to stay still is going to be the neck and the head. Anything else can move. Anything below it can move. All right, so I'm just, lift your head for a second. There you go, sit down. I just need a little more space. Okay, so in this case, my hand's gonna go around the full back of the neck. This is going to be on the bottom side. This is the top side. Okay? It's just the nature of how it's going to work. Thank you so much. Okay? So now what I'm going to do is I'm going to show you trying to get to some level of side bend or some level of rotation. I'll do rotation first. I can't do side bending this way. It's not going to work. Okay? So what we're going to do, rotate your torso forwards. Good. And you already feel some grab on it. Let it go. Go rotate backwards. And that's already as far as you can go. You feel that, right? Mm-hmm. Okay, so that's the level of connection. So what we're going to do, the one that felt a little bit more comfortable was when you rotated backwards, correct? Mm-hmm. Okay, so rotate backwards a little bit there. Don't go too far, geez. There, a little further back. There, stay there. Now I've got her in a position where I've got some connection to some restriction. I'm going into some level of restriction within this position. Her neck probably moves far farther than this. But what I'm going to do is look for an activating force above and beyond this. Okay, so stay here. Push your shoulders onto the table. Let them go, right? And that does a little bit of something, but I get no more rotation, right? Push your hips on the table. Let it go. So I get a little bit of connection, but nothing that I would want. Okay. So now what I have to start to recognize is that I may not get it in any other way than rotating the torso. Okay, so rotate your torso forwards again. Good. Rotate your torso backwards. And yeah, good. And forwards. This is a patient active rotation approach in lateral that will work for her. It's on and off the barrier in both directions. It's nice and comfortable. She controls it. No other activating force seems to do any of what we would want, right? So just to see what it would look like. Okay, now side bending, right? I'm going to try to open so that I want the ear and the shoulder to get farther apart from one another. So I can have, in some circumstances, my forearm on the head, my hand on the neck, and then I can control the rest of the body this way, right? So here, if I pull here, you start to feel mildly uncomfortable. Is that fair?
No, I'm okay. Okay, yeah, there.
Okay. I said start to. I never said feel really uncomfortable. But if I go straight this way, it's not so nice. Your head wants to lift. You feel your head lifting? Mm-hmm. Okay. Mm-hmm. If my hand's not here, the head will lift. So now if I go here, so I get the ear and the shoulder farther apart, this feels comfy. Is that fair? Mm-hmm. Okay. Now what I want you to do is push your shoulders on the table. Let them go. And I see how I get a tiny bit at the end, mm-hmm. right? Push your hips on the table and let them go. Nothing. Okay. Push your shoulders on the table. Let them go. Okay. Well, there's no more to get. That's as far as they go. Now, now, interestingly, that's not feeling bad now, is it? Mm-mm. It's like one contraction and it's different. It feels different. Okay. So just to display that on one person, you get up and you come over. Please, my friend. Thank you so much. So on your side, facing the fine people of the room. Okay, so as far as rotation is concerned, put the hand back. So this is the same move, the same setup, but it's going to probably end up being different. So Liz didn't move particularly far before we got some resistance or some connection. Okay, rotate your torso forwards. Right? Immediately, like there's some grab, you agree? Okay, rotate backwards. Keep going. Now we get some grab, right? So different, okay? So different magnitude of motion. This feels a little bit more comfortable, that's fair. The other way doesn't feel. Do you feel stuff?
It didn't feel bad the other way.
Okay, well then go the other way then. Let's.
It feels okay. It just.
Okay. What do you mean you don't know?
It doesn't feel bad or good. It's just.
Do you feel it
rolling forward and
back?
back?
But do you feel it a little bit tighter in your neck when you roll forwards? Like there?
A little bit.
Okay. This is one of the reasons why we're very cautious with patient report, because it may not accurately relate to what you're observing. Okay, so we've got them forwards, push your shoulders on the table, let them go. Lots of movement happened and really nothing that I would want happened, fair enough. Push your hips on the table, let them go. Yeah, nothing. So whatever, okay? So roll your shoulder forwards, good, roll it backwards, good, forwards. And see, it just moves different, more forceful, and then backwards. Right, and forwards. Keep rolling your torso, not just your shoulder. Yeah, torso. Yeah, there we go.
Right.
It's okay. Okay, so just so that you see that it's going to look different. Same hold, it will look different. The interaction with the individual on the table will be different. Okay, so I switch to a relatively similar position. There's going to be some minor differences because he's a different size. My hand is the same size, but because they're different, I have to do slightly different things. Now, again, I'm trying to get ear and shoulder apart, right? So positioning into it, okay? That starts to feel somewhat tight in the muscles here. Not bad. Now, if I go here, interestingly, it doesn't feel all that different. This still feels like it gets tight, right? Okay, so regardless of which way I steer the shoulder, it doesn't make it go, make him go farther into side bending, relatively speaking, or shoulder and ear apart with the ability to soften it up, right? So in this case, I just kind of figure, no matter which way I go, I'm not necessarily going to get the same sensation that I got with Elizabeth. So here we go. Push your shoulders on the table. Let them go, right? Push your hips on the table. Let them go. Interestingly, I got about the same amount of movement without as much abruptness out of the hips. Okay, so we'll push the shoulders down again. And let him go. Right, there you go. Now, because he let go softer, because I just mentioned it. Okay, push the hips again. And let him go. See, I actually get a similar thing as far as my ability to move out of the hips and the shoulders. So in this case, both work. Right? So just so you see those differences, that's why I want you working in groups of 3, so you can see those differences between the different people whenever you settle on a method that you're going to compare between the two.